Brushing your teeth is an essential part of your daily dental care routine, and, when done properly, leads to a healthy mouth and smile. Proper brushing should take at least 2 minutes and be done twice a day. Using a soft bristled brush and a fluoride toothpaste are recommended for removing plaque from your teeth. To follow the correct brushing technique, start by tilting the brush at a 45-degree angle against the gum line. Using short, back-and-forth strokes, gently brush the outer, inner, and chewing surfaces of the teeth. When cleaning the inside surfaces of your front teeth, make sure to tilt the brush vertically and move your toothbrush in up and down strokes. Finally, make sure to gently brush your tongue to remove bacteria and help freshen your breath. Remember to replace your toothbrush when it begins to show wear, or every 3 to 4 months. You should also change your toothbrush after you have had an illness. Keeping a regular toothbrushing routine and using proper brushing technique is one of the most important things you can do to keep your teeth free of bacteria and reduce the likelihood of tooth decay. In addition to following the proper toothbrushing technique, flossing is another important part of complete dental care. Flossing allows you to reach and remove plaque and food particles under the gum line and in between your teeth where a toothbrush can't always reach. Plaque buildup can lead to tooth decay and gum disease, so it is important and recommended to floss daily. To follow the proper flossing technique, start with about 18 inches of floss, winding most of it around each middle finger so that about 1 to 2 inches of floss is left to work with. Hold the floss tautly between your thumbs and index fingers, sliding it gently up and down between your teeth. To get beneath the gum line, gently curve the floss around the base of each tooth. To prevent cutting or bruising your gums, do not snap or force the floss. Make sure to use a clean section of floss as you move to different teeth. When removing floss, you can use the same back and forth motion to bring the floss up and away from your teeth. There are multiple varieties of floss available. Consult your doctor on what type is the best fit for you to promote your oral health.
Brushing alone is not enough. If you just brush, food and debris get left behind. The Waterpik Water Flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into handle. If this is your first use, you'll need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik Water Flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth with the Waterpik Water Flosser.
Plaque and calculus are the 2 types of deposits that adhere to teeth and are the primary causes of gum disease. While they may sometimes be discussed interchangeably, there is a clear difference between the 2 forms of buildup and how they affect your oral health. Plaque is characterized as a soft, sticky layer of acid-producing bacteria that constantly forms on the teeth and along the gum line as a result of normal function and food consumption. It is easily removed from the teeth with regular brushing and flossing. However, when not removed regularly with proper oral hygiene, the acid secretions eventually cause irritation and inflammation to the gum tissue and can result in tooth decay. If the plaque is allowed to remain for too long, it combines with minerals in the saliva and hardens on the teeth and becomes what is known as calculus, also referred to as tartar. Calculus, unlike plaque, is a hard, mineralized substance that deposits on the teeth, which builds up in layers and thickness over time. It creates an uneven surface on the teeth that allows for additional plaque and ultimately calculus to form over it. Like plaque, it harbors toxin-emitting bacteria that can irritate and inflame the gum tissue, and over time cause gum disease and recession of the gum tissue. Unlike plaque, once calculus has formed on the teeth, it cannot be removed by everyday brushing and flossing and requires a professional dental procedure to remove. Depending on the extent of calculus buildup, a specialized multi-visit procedure may be required to remove it all. If plaque and eventually calculus are allowed to remain on the teeth, over time the irritation and inflammation of the gums can progress to gingivitis and eventually periodontitis. It is important to practice good oral hygiene at home and maintain regular hygiene appointments so your doctor can monitor any potential risks. Gingivitis is an inflammatory condition of the gum tissue caused by the buildup of bacteria on the teeth. It is an early form of gum disease that has not progressed to the point of tissue or bone loss. When plaque is allowed to remain on the teeth, the bacteria within it begins to cause redness, irritation, and swelling of the gum tissue. Since gingivitis rarely causes pain, most patients do not even know when they have it. Additional symptoms can also include sensitivity and tenderness of the gum tissue and slight bleeding when brushing, flossing, or probing during an examination. You may notice your toothbrush or floss having a slight pinkish tone to them after use. If left untreated, gingivitis will progress and further complications can arise. It is important to consult with your dentist on the best course of action to halt the disease progression. Periodontitis is a serious gum infection that causes damage to the gums and bone that can eventually jeopardize the health of your teeth. Healthy gums are typically pink in color. Some symptoms of periodontitis can include red, swollen gums, gums that recede from the teeth, loose teeth, and bad breath. Although in some cases the infection may be deep below the surface, in these cases the gums may appear to have few external symptoms. Regardless, if left untreated, periodontitis can lead to significant gum recession and bone loss, which can then cause tooth loss and serious health problems, including increased risk of heart disease. Periodontitis is a disease, but its effects can be stopped if proper treatment is sought. Once your doctor has restored your mouth to a healthy state, further complications can be prevented with regular dental appointments and proper home care. If you have been diagnosed with periodontal disease, your doctor may recommend a more advanced cleaning called scaling and root planing as the first step in treating it. There are some significant differences between this and a routine dental cleaning that are important to understand. A routine dental cleaning is designed for prevention, meaning its purpose is keeping gum disease and tooth decay from developing. It involves your hygienist cleaning your teeth above the gum line, removing plaque, tartar, and stains, as well as polishing them. This usually takes place every 6 months. On the other hand, scaling and root planing is a specialized procedure meant as an initial treatment for patients diagnosed with periodontitis to remove the excessive plaque and bacteria deposits that caused it and halt the spread of the disease. It involves your doctor or hygienist removing excessive calculus and bacteria deposits deep beneath the gum line, and is usually performed with a hand instrument and an ultrasonic cleaner that uses high-frequency vibration to separate the calculus from the tooth. Additionally, any uneven surface areas of the teeth will be smoothed out to discourage additional bacteria from attaching. The procedure may require multiple appointments done in stages to ensure you are as comfortable as possible. Scaling and root planing is a vital treatment to control the spread of periodontal disease and prevent additional complications to your oral and systemic health. Once completed, your doctor will work with you to create a maintenance schedule that best promotes the continued rehabilitation of your gum tissue. The process of tooth decay starts with plaque and bacteria building up on the tooth structure, creating acid. This acid begins to erode the hard protective coating on the tooth, also known as the enamel. Once the acid breaks through the outside layer of the enamel, the decay spreads faster due to the inside layer, known as the dentin, not being as hard as the enamel. If the decay is allowed to expand through the dentin, it can penetrate the interior of the root, requiring additional procedures to remove the infected tissue. A range of external damage can result from this decay as well, such as cracking or fractures in the tooth, potentially progressing beneath the gum line and along the root structure. This could ultimately result in the loss of the tooth. It is important to detect and address issues of tooth decay early in the process to prevent these unpleasant and expensive consequences. Regular visits to your dentist, good oral hygiene, and a proactive attitude towards your dental health will help minimize this risk. When repairing a small cavity, a composite filling can restore your tooth to shape and function while also mimicking a tooth's natural shade. During the first step, your tooth is prepared by removing the decayed portion, leaving a small area that will be filled with the composite. Next, a special bonding agent is applied to the prepared area. This bonding process helps to ensure that the filling will attach to the natural tooth structure. A special curing light is then used to set the bonding fluid. Your dentist then applies the composite material to fill the prepared area and shapes it to match the contours of your tooth surface. Again, using the special curing light, the shaped composite is hardened to resist the forces of the opposing teeth. As a final step, your dentist will polish the composite filling to smoothen it and give it a similar sheen to the rest of your tooth. Once completed, your tooth is free of decay and restored to its natural strength and appearance. When a tooth's structure is compromised, a crown rebuilds the tooth to optimal shape and function. A crown can be metal, ceramic, or ceramic covering metal. It typically requires multiple appointments to complete the process of getting a crown. At the first appointment, your doctor will take an impression or mold to help make a temporary crown for your tooth. Next, the tooth is prepared to make room for the crown. Your doctor will take another impression of the prepared tooth and put in a temporary crown while your final restoration is being expertly constructed by a dental laboratory. At a subsequent appointment, your doctor will remove the temporary crown and replace it with the final restoration. Once completed, your tooth is now restored to ideal shape and function. A root canal is needed when the nerve of a tooth has become damaged by injury or infected by decay. This procedure saves the tooth and can help restore it to natural function. For the first step of this procedure, your doctor numbs the area and then creates an opening in the tooth to access the root's interior. Your doctor will then remove the infected tissue. and flush and clean the area. Next, the root is filled with a special sealing material, and the opening is filled and sealed. The tooth has been saved and restored to its natural function. When a tooth is lost, the effects are not solely limited to the immediate area. There can also be progressive adverse effects to the surrounding and opposing teeth that should be reviewed with your doctor. When a tooth is lost, whether to an injury or decay, if the empty space left behind is not occupied, the structure of the mouth can begin to alter as a result. To start, the immediate area where the tooth is lost suffers adverse changes in the bone and gum support, typically in the form of tissue loss. These changes can spread to the neighboring teeth, resulting in loss of bone support and the teeth drifting into the vacated space. Additionally, the tooth opposing the empty space begins to ascend or descend into the space in a process called over-eruption. This then jeopardizes additional surrounding bone structure and teeth. The progression of alterations can lead to issues with a patient's bite, as the teeth gradually become misaligned. Each step in this progression can escalate the severity of holistic damage to the mouth, as well as the measures needed to remedy it. Your dentist is the best resource to help assess your current dental health and recommend the best treatment to fit your unique situation. Replacing a tooth can be accomplished with a dental implant. A dental implant restores the mouth to optimal function, stabilizing the surrounding bone, tissue, and teeth by substituting the root structure of the missing tooth. This helps to prevent further serious complications that can arise if the missing tooth is left untreated. It usually requires multiple appointments to complete a dental implant placement. First, the site is prepared for placing the dental implant. Second, the implant body is placed into the bone, along with a special healing cap. The site is then allowed to heal, providing a stable footing for the replacement tooth. At subsequent visits, your doctor will monitor the healing process, letting you know when the tooth is ready for the final restoration. When the site is fully healed, the healing cap is removed and the final restoration is set into the implant and secured into place. With your implant placement complete, your tooth is restored to ideal shape and function while continuing to stabilize, protect, and preserve the surrounding tissue. A bridge is used to replace a missing tooth. It uses teeth on either side of the missing tooth for support. The bridge can be metal, ceramic, or ceramic covering metal. It typically requires multiple appointments to complete the process of getting a bridge. At the first appointment, your doctor will take an impression or mold of your teeth for the temporary bridge. Next, the teeth on either side of the missing tooth are prepared to make room for the bridge. They will become the support structure for your new tooth. At this point, another impression is taken of the prepared teeth, which will be used to craft the final bridge. In the meantime, a temporary bridge is made and put into place while your final restoration is being expertly constructed by a dental laboratory. At a subsequent appointment, the temporary bridge is removed. The final bridge is fitted and attached to your teeth. Once completed, the area is now restored to optimal function and appearance. When a patient's condition does not allow for a bridge or dental implants, removable partial dentures are an excellent treatment option to replace missing teeth. They provide improved aesthetics by replacing the missing teeth in the mouth and improved overall function for eating and speech. It will typically take multiple appointments for your doctor to design and fit a set of removable partial dentures for you. Removable partial dentures are an appliance placed in the mouth containing replacement teeth, typically mounted in a base made of a pink gum-colored resin formed over a wire frame. They are designed to be removable without the assistance of a dental professional. The process of creating the dentures begins with your doctor taking several impressions of your existing teeth and the area's missing teeth. These impressions are then sent to a laboratory, where an expert technician builds a model of your mouth. The lab then works closely with your doctor to design your appliance using the model as reference. As each phase of the design is completed, your doctor will meet with you to check for proper fit and bite alignment. It usually requires multiple incremental fittings to ensure the best final result for you. After a brief period of adjusting to the feel of the appliance in your mouth, you will gradually be able to eat while wearing your dentures, making eating easier and more pleasurable for you. Once your dentures are finished and you have fully adjusted to them, you will have a removable restoration specially designed to mimic the appearance of natural teeth that improves the overall function of your mouth. Sometimes teeth can develop cracks, and when not treated, this can have serious consequences for your oral health. Cracks can come from injury or large fillings that weaken the rest of the tooth. Even small cracks can allow bacteria into the tooth, causing decay or infection, leading to further destruction. A cracked tooth may or may not be sensitive to hot and cold or be painful when biting or chewing. Cracks that progress too far can result in entire sections of the tooth breaking off, and in some cases, loss of the tooth entirely. Tooth wear is a dental condition where the surface and structure of teeth are progressively reduced as a result of internal and/or external forces placed upon them. When hard tooth material is worn away as a result of teeth grinding and/or clenching, it is called attrition. The extent of wear damage depends on the amount of grinding and is typically more severe in individuals who exhibit this behavior in their sleep. The reduction of hard tooth material due to chemical forces is called erosion. It can be caused by drinking acidic beverages like soda or by medical conditions like acid reflux or bulimia. Over time, this acid dissolves the outer enamel of the teeth and can expose the softer underlying dentin layer. Wear caused by an outside object is called abrasion. Abrasion can be caused by improper toothbrushing technique, excessive use of toothpicks, and the use of the teeth as a tool. It can result in grooves and notches in the enamel that can also expose the dentin. Excessive tooth wear causes many oral health complications, including unattractive and irregular tooth levels, jagged and sharp tooth edges, tooth pain, and eventual loss of the teeth altogether. As the harder outer surface of the tooth is worn away, the softer dentin will be exposed, speeding up the process. There are preventative and corrective treatment options for patients experiencing tooth wear issues. Treatment will vary based on the cause of wear and when it is detected, making it critical to work closely with your doctor to proactively treat the issue before more damage is sustained.
Everyone knows that straight teeth give you a beautiful smile. Did you know that straighter teeth can also affect your overall health? Crooked or misaligned teeth, also known as malocclusion, affects 74% of American adults. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The effects of crooked teeth can worsen over time and may adversely affect your overall health. Common types of misalignment include crowding, spacing, deep bite, open bite, cross bite, edge-to-edge bite, and excessive overjet. Crooked teeth can affect your bite, creating unnatural stress and pressure, leading to premature wear. Teeth that are subject to excessive pressure can develop chipping and notches at the gum line. Over time, the excessive force may also cause flattened or worn down teeth, or chipping and fractures at the edges of teeth. Additionally, a bad bite may produce improper forces on the jaw joint that may lead to pain in the jaw, earache, and even headaches. Premature wear can lead to gum recession, poor bone support at the roots, loose teeth, and eventually tooth loss. Teeth that fit together correctly last longer and are likely to need less costly dentistry in the future. Crooked teeth can affect your periodontal health because it's difficult to remove plaque and bacteria from the crowded areas. Bacteria that is not properly removed will multiply and trigger periodontal disease, which begins as gum inflammation, redness, and bleeding while brushing and flossing. If left untreated, over time, gum inflammation will progress to chronic infection, soft tissue damage, receding gums, periodontal pockets, bone loss, and eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages. Crooked teeth that are left untreated can trap bacteria that damage gum tissue cells and invade blood vessels. This can cause damage to cells that line your coronary arteries, increasing your risk for heart disease stroke, and other illness. Correctly positioning your teeth for proper alignment and function will help prevent future dental problems and make a significant difference toward a healthy mouth and keeping your teeth for life. Ask your doctor and hygienist today about Invisalign, a series of clear aligners that are custom-made to gradually move and align your teeth. And start on the road to a healthier you today.
When an individual is unhappy with the color of their teeth, sometimes whitening can be used to brighten up their smile. First, a mold is taken of your teeth so an exact replicate of the teeth can be made. Next, they will use the mold to make a custom tray to hold the whitening gel against your teeth. These trays are yours to keep and can be used whenever you feel you need an additional whitening in the future. Once the tray is ready, whitening gel is placed into the tray and then fitted onto your teeth. Your doctor will show you how to perform additional applications of the gel from home. After a short period of time, you will notice you have whitened teeth and a more attractive smile.